Alright, greetings and welcome to Cadaver Confessions. This is a small session that we're going to be doing focused on a particular metal in toxicology. My name is Dr. Som and I'm going to be going ahead with you today on this particular joyride. Now what happens generally with the students is they tend to get very anxious when toxicology comes into play. Toxicology, be it for an undergraduate syllabus or for an FMG or for NEET preparation, is actually very important and it's very simple to understand. There are very specific points and topics that need to be noted. For that, let me give you just a basic idea on why it's important for us to be aware of toxicology. Let's move on to 1940s in India. This is a pre-independence era. Now you have a case scenario in a North Indian state wherein there is a young female who's actually been employed to work as a cook in a particular household. Now this female, she is seemingly harmless. She's working as a cook and she's been doing so for quite some time. Now this particular female one day prepares a particular food item and gives it to the individual who has contracted her to be a cook. Now this particular individual, after consuming this food item, thereby starts having manifestations or symptoms. These symptoms include becoming blue, having vomiting, difficulty in breathing. All of those things tend to get aggravated over a period of time, and then this individual is finally brought to a registered medical practitioner or a doctor for treatment. This doctor, now this person was relatively smart, and what he did is he evaluated those symptoms and he said this person who's having diarrhea, who's having vomiting, nausea, having signs of shock may be a victim of poisoning because the symptoms have aggregated post ingestion of a food item. Now he does something called as a Marsh test and it tells this particular doctor that the case scenario actually involved a heavy metal, and this metal is called as arsenic. Arsenic basically is the poison, and this poison is very commonly used in a lot of folk medicines or naturopathy based cures. It did have, or it was supposed to have, a lot of benefits, but yes, it is relatively easily available, and later on it was found out that the cook was actually related to the late wife of the person. This person was then poisoned because she suspected him of killing his sister. So yes, this happened. This was a case in 1940s. It was one of the first incidences wherein heavy metals was actually used, diagnosed, and then finally detected to be used in a perpetuated or a attempted homicide. What exactly is arsenic? Now, arsenic is a very commonly available compound. Arsenic is a metal, and in its purest form, in its metallic form, it is not absorbed from anywhere in the gastrointestinal tract. It is absolutely inert. If you consume it in its purest form, it's going to enter your system, it will get processed, and it will evacuate itself through the balls without causing any manifestations whatsoever. However, it does have certain toxic forms, and the toxic forms include arsenic trioxide or sakya. This is one of the commonest powder-based forms which are available. It is a remedy in folk medicines. It is also used in certain gold industries. It is also used in metal industries. It is also used as pesticides. Then you have your copper arsenite and arsenic sulfide. These are relatively specialized compounds which have specific uses in other industries. Common sources for arsenic, especially for general populace in India, they include contaminated water. This is by far the commonest source because groundwater will be contaminated by arsenic due to say pollutants or pre-existing arsenic in nature. Then you have your pesticides. Colored sweets, not so common in India anymore. We've had really stringent standards, but in places where those standards are not followed, very rural or backward areas maybe. And of course, smokers, tobacco smoke does contain arsenic, so keep a keen eye out whenever next time you decide to light up. The most toxic form of arsenic is actually arsenic trioxide. It's a gaseous form. It's a gas. And in the early part of the 19th and 20th century, especially during the time around the World War I, this was used as a war gas. So yes, it's very toxic, and we have to remember this because most of our sessions or treatment modalities tend to focus on arsenic either in its gaseous or in the form of arsenic trioxide. So just to recap, arsenic, metallic, not poisonous, no symptoms. Toxic forms include arsenic trioxide and the gaseous one. MCQ for you, most toxic form is the arsenic in its gaseous form, and yes, it can cause manifestations. The manifestations or the mechanism of action for arsenic toxicity can be easily remembered through the 4A method. This is a mnemonic for you. If you know 4 A's, the first and foremost in its mechanism of action, it is going to affect something called as a pyruvate dehydrogenase. This is an enzyme which is responsible for activity along the TCA cycle or the Krebs cycle, which further is going to stop the Krebs cycle, causing ATP depletion. Yes, if the Krebs cycle is no longer working, you do not have oxidative phosphorylation and you do not have ATP generation, and all of this occurs because lack of pyruvate dehydrogenase is going to cause mitochondrial uncoupling. This mitochondrial uncoupling and the resultant lack of ATP production is now going to cause a reduction in the formation of acetyl coenzyme A. And acetyl coenzyme A reduction further is going to cause programmed cell death, and of course it is going to increase the oxidative stress inside the body. So in summary, what does arsenic do? It causes enzymes to be affected, specifically those enzymes which are acting in the TCA or the Krebs cycle. It is going to inhibit pyruvate dehydrogenase. Pyruvate dehydrogenase, once it is inactivated, in this scenario what happens is, then this pyruvate dehydrogenase, this particular enzyme right here, is going to cause ATP depletion. So once ATP is depleted, further acetyl coenzyme A formation is going to be reduced, and this acetyl coenzyme A is going to then affect the apoptosis, and it is going to increase oxidative stress. But why does all of this happen? What mediates it? Can it just be arsenic in its toxic form? No. It actually has a excuse me, it has a mechanism of action that follows only and only one particular thing, and that particular thing is the sulfhydryl groups or the SH groups. Now this is very, very important. If you don't know this particular aspect, it becomes very difficult for you to understand what is coming up. Sulfhydryl groups or SH groups basically are a very important component in the proteins, especially along the cysteine amino acid complex. Now what SH groups do is that they are responsible for mediating enzyme activity. One of the prime jobs that they do is they act as ligands, and they tend to mediate enzyme activity. They have an antioxidant effect, and they work with metals, and they promote the utilization of micrometals or important metals inside the body. So when you're thinking about iron, manganese or zinc, which have therapeutic benefits, it is actually the SH groups which are acting on it. Now what arsenic does is, it binds with these SH groups, and thereafter it inhibits all enzyme activity. It is going to inhibit antioxidant activity, and it is going to ensure that any metal which is there in the body, which is useful for the body, like iron or zinc or magnesium, is not acted upon, and this is going to cause ATP depletion, phosphorylation is reduced, acetyl coenzyme A is reduced, and thereafter programmed cell death occurs. Acute arsenic poisoning is the most common manifestation. Now you have two groups, of course. You have your acute group and you have your chronic group. Acute means something that has happened very recently. It is just immediate ingestion and the manifestations that come back. Arsenic is going to mimic cholera. This is something you have to remember. Arsenic is always and always going to mimic cholera. So if there's somebody who has consumed arsenic orally or has been exposed to say arsenic gas, one of the major symptoms is going to be cholera-like, but the entire subset is affected. The entire body, each and every organ and system is affected due to arsenic in its acute state. I have a particular gas champ as a mnemonic for it, because gas is again the most toxic form of arsenic. So gas champ, and how we remember is G for GIT symptoms, which are the most predominant ones. You know, vomiting, rice water stools, and a metallic taste, very similar to cholera. For A, you have your acute respiratory distress, pulmonary edema, and of course the tachycardia that comes with it. S is for the skin features that are delayed healing and dark patches. Very, very important for you to remember the skin features. The CNS, you have your headache, vertigo, confusion, hepatitis, fatty liver, oliguria, kidney damage, musculoskeletal pain, that is severe body ache, and of course peripheral collapse and shock. These may seem very vague, but if we correlate them with the chronic ones, it becomes very easy for us to do. How do we diagnose it? Very, very important. How do you actually diagnose, or are you confirm whether a person who's having oliguria, musculoskeletal pain, nausea, vomiting, diarrhea, tachycardia, all of those symptoms, they can have a number of differential diagnoses. So how do you go ahead and diagnose it? You do it based on these particular tests. Now, if you're suspecting acute arsenic poisoning and you have urine access to the patient, you have samples of the patient, so anything above 50 micrograms in a 24-hour period, of course, indicates that yes, this person is suffering from acute arsenic poisoning. The gold standard here is, of course, the blood level. The blood level is the gold standard. Blood arsenic levels more than 0.9 microgram per deciliter detected at any point of time is a confirmatory sign of acute arsenic poisoning. In chronic cases, we do find it in the hair and nails. In individuals who ingested a form of arsenic that is not completely inert, we find radio-opaque shadows in the abdomen, and of course we have non-specific features affecting the heart. The treatment, the major treatment, the primary treatment, of course, is going to be chelating agents. Chelating agents are basically those agents, if you remember the session on general toxicology, chelating agents do bind with these particular metals and form non-reactive bonds and are thereby excreted. The first and foremost, of course, is the British anti-leucide, also called as dimer-caprol. Very important. Student gets confused so many times that dimer-caprol is something else. No, dimer-caprol and British anti-leucide is one and the same thing. This is the mainstay of treatment, dimer-caprol. Apart from that, you can use other chelating agents also, like DMSA and DMPS. They have their own advantages and disadvantages. British anti-leucide is given intramuscularly in a bolus dose. This is a deep intramuscular injection. It's relatively painful, but it's considered still to be the best treatment modality. We use demulcents like butter to actually coat the GI and reduce the irritant effects of arsenic. If there is facilities, we use DMSA or DMPS, especially we use it in chronic use. DMSA is actually used for oral administration. It's very easily to be administered orally, while DMPS is given in the parenteral or the IV route, so less painful than British anti-leucide. Oral Sasimar only given in mild cases, chronic exposures. Gastric lavage, hydration, exchange transfusion. Laxatives were given initially for oral ingestion so as to excrete the arsenic. They are not a first line treatment, they are just a supportive care, and of course we have to remove from the source. Chronic arsenic poisoning generally happens due to exposure either in the industry, either through water, or of course you have a group of people who are called as arsenophagist. What are arsenophagist? Arsenophagist basically are individuals. These individuals are ones who consume arsenic in small quantities over a long period of time to develop a tolerance. This is another MCQ for you. Arsenophagist. These individuals also have signs of chronic arsenic poisoning. It does have a very long half-life. Arsenic is actually something that is cumulative in nature. It is stored in the hair, nails and skin. We can remember the signs and symptoms of chronic arsenic poisoning through another mnemonic called as gospel charm. GI cramps, constipation, salivation, very similar to what we find in acute, but here we have something called as watering and photophobia. You have manifestations in the eyes. This is of course due to the irritant effects of arsenic. The two very typical signs or very typical signs of chronic arsenic poisoning. This is an MCQ for you. Typical signs of chronic arsenic poisoning include these two manifestations. They are first and foremost raindrop pigmentation, secondly Mees lines, and third leucomelanosis. These are considered to be the typical manifestations of chronic arsenic poisoning. So if you're getting an MCQ asking you which of the following is a typical manifestation, This is, or if you're getting a clinical or reasoning based MCQ asking if these are the manifestations, can you give a diagnosis, then you have to straight away jump to chronic arsenic poisoning. These are very, very important. Rest of them are considered to be generalized or non-specific in nature. What exactly are these? These are the Mees lines. Now, Mees lines basically are striations that you can find in keratin-based tissue, very, very evident in the nails. So, what happens is, as chronic exposure to arsenic happens, you get these incremental lines, or called as Mees lines. And then, of course, you have raindrop pigmentation. This is patchy areas of depigmentation seen very commonly over the limbs, the chest, or the back. And then you have your leucomelanosis. This is exact opposite of raindrop pigmentation, where here you're getting patchy white areas, here you're getting dark areas. PM findings, of course, are non-specific in nature. There is one very specific post-mortem finding, but you only see this in oral ingestion, and that is going to be the red velvety appearance of the gastric mucosa. Apart from that, things that can hint towards arsenic poisoning are presence of keratosis, pigmentation, liver congestion, and generally congestive changes. It is very commonly used for homicide because it does not have a very specific taste. It's very cheap, easily to procure. Suicides, we don't do it. Nobody wants to commit suicide by dying as a result of loose stools, vomiting, diarrhea, shock, progressing further, getting troubled for a few days and then dying. Yes, accidental is very, very common. We do get access via adulterated or polluted water. Occupational exposure is there, and sometimes in occupational or accidental exposure, it may lead to a condition called as Blackfoot disease. Blackfoot disease is a peripheral vascular disease in which arsenic is going to cause vasoconstriction along the external limbs, and this causes something called as Blackfoot disease. Previous year questions or important questions for FMGs actually are these. Red velvety mucosa in case scenarios are going to be diagnostic of arsenic. Mees lines, incremental lines, again indicate arsenic poisoning. So if you find these lines anywhere, immediately jump to arsenic poisoning. Raindrop pigmentation, chronic arsenic storage, all of those things are considered to be important topics for FMGEs. Recently, a question was asked that activated charcoal is not used in which of these conditions. So yes, activated charcoal, generally what happens is we jump to the conclusion that anything is orally ingested, give activated charcoal. Please don't do that. You have to remember this. Activated charcoal is an adsorbing agent, ADSORB. It absorbs any toxin that is present in the GIT. So what happens here is, it has to be a toxin that is going to be adsorbed by activated charcoal. We don't give activated charcoal in strong acids or bases. Why? Activated charcoal is mixed with water. Once it comes into contact with any acid or base, it is going to cause an exothermic reaction. Patient's stomach is going to go, we don't want that, right? Secondly, for metals such as iron, lithium, and arsenic, they do not get attached on the surface of the arsenic. They do not go, the iron, lithium, and arsenic do not get attached to the surface of the activated charcoal. So even if you're giving activated charcoal, it's not going to be of any use because it is not going to pass through. And lastly, you have volatile substances like methanol, ethanol, and ethylene glycol. Again, these are not going to be removed by activated charcoal. So activated charcoal is not recommended in all of those things, as well as a heavy metal, that is arsenic. It is given in other heavy metals. You give it in lead, you give it in mercury. With that, thanks guys. This is a short video for you guys. Cadaver confessions, keep going, keep joining, and if you have any questions, queries, or comments, please do tell us on our board. Thank you so much.